All right. Hi, everyone. I'm just going to wait a couple of minutes just to see if people want to trickle in, and then I'll begin today on Lyme disease. All right. I think I'll begin now. Hi, everyone. If you haven't met me yet, my name is Matilda. This is my second live video with Connections Resource Center. Very exciting. I hope everyone has had a wonderful family weekend, whatever family looks like to you. I got to go skiing this weekend, which was really fun. I hadn't skied in a long time, so that was nice. A bit about myself before I begin. I'm from Sudbury, and I'm also a first-year medical student here at the University of Ottawa. And I love the outdoors. I spend a lot of time hiking. I used to go camping a lot. I play a lot of outdoor sports. And as we all know, the outdoors do come with a lot of cautions. And so that kind of brings us into today's topic, which is Lyme disease and how to be Lyme safe. Um, so I think I'll start a little bit with the history of Lyme disease. So it's a fairly new disease that's been discovered. So in the early 1970s, the citizens of a town called Lyme in Connecticut in the United States started experiencing some weird and unexplained symptoms. And it seemed viral, but they couldn't really place it to a virus. And then by the early 1980s, it was found that this new disease, coined Lyme disease after the town, was carried by ticks. And so, yeah, a new disease was found called Lyme disease. And so currently in Canada, we have two types of ticks that really cause Lyme disease. And so we have the deer tick, which is in southeastern Canada. So that's where we would find it here in Ottawa. And we also have the black-legged tick in BC. And so ticks, as of right now, are quite southern in Canada, but it continues to spread north as the climate gets warmer. So, for example, I mentioned earlier, I'm from Sudbury, and I think this past summer was when we started seeing an uprise in positive Lyme disease cases from ticks because, climate's getting warmer, and so ticks are able to survive in more northern cities. So the prevalence keeps increasing, which is why I think it's important for today to learn a bit about Lyme disease. And so now I'm going to talk a bit about the spread of Lyme disease. So Lyme disease itself is caused by a bacteria called Borrelia burgdorferi. And as I said before, Lyme disease is spread through tick bites. And so what happens is a tick, which are like small little bugs that bite and suck your blood. Basically, first they bite an infected animal like a deer or a moose or other rodents or even birds. And then they bite a human and they transmit the bacteria, which causes Lyme disease in humans. And so most humans are infected through the bite of immature ticks called nymphs. And so these nymphs are born in the spring and early summer, which is when our infection rates are the highest, which makes sense because if they're the ones infecting us, and that's when they're most prevalent, our infection rates would be the highest. And these nymphs are about the size of a poppy seed. They're quite small. And then adult ticks, which still can bite, are about the size of a sesame seed. And so in order to contract Lyme disease, the infected tick must be attached to your body and feed for at least 24 hours before the bacteria can be transmitted. So that's crucial to know when we talk about prevention later on in this talk. And ticks are also active when the temperature is consistently above freezing and the ground isn't covered by snow. So they need warm, moist areas to survive. So that's why you won't see tick spread in the winter. And that's why more northern climates aren't affected by Lyme disease. And that's why as, temperature gets warmer and, as we get more north, it's starting to warm up. That's why we start seeing ticks move into these areas. That's why we didn't have ticks, before in Canada. Or sorry, not ticks, Lyme disease. And so I think we went through the spread. And so now I want to talk a little bit about the symptoms of Lyme disease. So initially, when you get the bite by the tick, you won't really feel the bite. It's quite painless. It's a very small tick. As I said before, it's about the size of a poppy seed. So you won't feel the bite. Instead, you will feel the symptoms from what happens when, Lyme disease is transmitted to you. So there are actually 3 stages of Lyme disease, and they're called early localized disease, early disseminated disease, which means it's spread a bit more, and then late disease. And so each stage of this disease does have its, clinical features and symptoms and signs, but each of these can overlap with each other. And some patients can even present with late disease of Lyme without any history of earlier symptoms from the 2 earlier stages. So it does make it a bit more difficult to diagnose, which is why it's important to know that you don't need to have the earlier stages to get the late stage, and to know the specific symptoms so that you can, catch Lyme and treat it, because it is a newer disease here in Canada, and often it can go missed for a while. That's why it's important to be able to recognize the symptoms. So we'll begin with the first stage, which is again is called early localized disease. And one of the hallmarks of this early localized disease is a rash. And this will begin from 3 days to 30 days after the tick bite. And so the rash itself, the fancy name is called erythema migrans, but we will typically call it Bullseye. And so basically it's an expanding red area. You'll see it gets larger and larger, and it's red, but the inside will be clear. It'll be your normal skin color. And so that's why it's called a bullseye, because you get this red ring with the clearing on the inside, and it continues to get larger. It's also only red, but it's not itchy or painful. So that's how you can distinguish it from maybe like a poison ivy or something, is that it shouldn't be itchy, shouldn't be painful. It's just red and it looks like a bullseye. And then, so for early localized disease, we said rash, but there's also flu-like symptoms. So that includes fever, chills, fatigue, body aches, and headache. And that's one reason why Lyme disease can be difficult to diagnose, is because the symptoms I just told you, you get that with the flu, you get that with COVID, you can get that with the common cold. And so it can be difficult to catch it early, which is why when we get into prevention later, it's important to really think about the prevention methods to try and prevent ourselves from getting Lyme disease, because not everyone presents with the bullseye rash I just spoke about. So that's the early localized disease. So I said the rash and the flu-like symptoms. Next, we move on to stage 2, which is the early disseminated stage. And this typically occurs from weeks to several months after the onset of Lyme disease infection. And so the first symptom, I guess, to look out for would be multiple bullseye lesions. So now you have, instead of just one, you can have multiple. And this isn't a sign of multiple tick bites, but it's a sign of early disseminated stage, which is our second stage. So that's one thing to look out for on your skin. And then you also have neurological problems. So now, since it's spreading, the Lyme disease, you're starting to get more problems with the rest of your body. And so one of the neurological problems you can look out for is facial drooping. So one side of your face might start to droop a bit, like maybe your skin will hang, your eyelids will hang a bit. This can also be called Bell's palsy. So that's definitely a sign to look out for. You can also experience meningitis, which is the inflammation of the meninges, which are like protective coverings of your brain and spinal cord. And you can also get peripheral neuropathy. And basically that's like weakness, numbness, and pain outside of the brain. So it's not your brain that's experiencing it, but it can be like your fingers, your limbs, anything like that. And then also with this early disseminated stage, so we said the multiple bullseye lesions and the neurological problems, but you can also experience some cardiac problems. And so one of these can include arrhythmias. They're called atrioventricular heart blocks. Essentially, it causes your heart to beat a bit slower than usual. And you can also experience pericarditis, which is the inflammation of the lining surrounding your heart. And then finally, in early disseminated stage, you can also look out for certain eye manifestations, such as conjunctivitis, which is also known as pink eye. All right, so in early disseminated stage, we said multiple bullseye lesions, neurological problems, cardiac problems, and eye manifestations. And so now we're going to move on to our third stage, which is called late Lyme disease. And so this occurs months to a few years after the onset of infection. And the symptoms that kind of characterize this stage is called, it's intermittent or persistent arthritis. So it's either constant arthritis or it can be arthritis that comes and goes. And this usually involves one or a few large joints, specifically like the knee, for example, or the hip. This can also be characterized by certain rare neurologic problems like encephalopathy, which is damage to the brain, and polyneuropathy, which again is the weakness and the tingling and the numbness in your peripheral regions. And this can also be characterized by severe fatigue. So you will be very tired and you'll feel very like lethargic. So yeah, we went through the symptoms of the early localized disease, the early disseminated disease, and the late to Lyme disease. I'm just going to read through the comments to make sure I'm not missing anything. Yes, it is difficult to diagnose. We'll get to that in a second. That's actually next on the things we will be talking about today, so that's perfect. I can talk about that right now. So yeah, one reason why diagnosis can be difficult is because it mimics a lot of other things. Like, as I said at the beginning, if you don't have that bullseye pattern, you just have the flu-like symptoms. But, some people just think it's the flu and then they won't go and get checked up and they won't get treatment. And then it can keep persisting and developing into the later stages, which can cause the problem. And also, I believe one of the reasons why Lyme often it goes misdiagnosed for a bit is because it is newer and it's not often on the radar of a lot of diagnoses. Like, people aren't thinking about it when you go into the office because it's newer and we just haven't seen it enough. But I think now that it's getting more prevalent here, it'll definitely be picked up more often, which is really good. There needs to be more what's the word? There needs to be more, I can't think of the word right now, but yeah, it just needs to be talked about more so that people know to look for it and pick up on it more often, for sure. So with diagnosis, again, for the first stage, early localized, typically it's the lesion is enough. The bullseye lesion is enough to indicate that you need antibiotic therapy. They won't do any other tests because when you have that bullseye lesion, they're normally pretty sure that it would be Lyme disease and they'll give you antibiotics right away because it can't hurt to give you the antibiotics. It can only protect you from developing Lyme. There is the option of serological testing, which is like blood testing for any antibodies that your body has created against the Lyme disease bacteria. Although this isn't used for people with the bullseye lesion because the bullseye lesion is enough to diagnose. But if you aren't sure about the skin lesion and you don't have the skin lesion, but you have the symptoms, you can be given this serologic testing. And what they'll do is they will give it and they will do it again in 2 to 3 weeks to determine if you have been infected, because often in this early stage, your body hasn't produced the antibodies yet. And so that's typically why we don't do the blood testing, just because it might come up negative, even if you are positive. So that's why they repeat it in 2 to 3 weeks if you don't really have that skin lesion. So they're not sure, but they want to just make sure that they're not missing Lyme disease. They'll repeat it when they think that your body would have produced the antibodies by then. And that's to determine if you are infected. Then we have diagnosis for early disseminated and late Lyme disease, which is stage 2 and 3. And so in this case, we do use serologic testing, and that's used to support the diagnosis. So at this point, you think that they have Lyme disease, but they do the serologic testing because at this point, you have had Lyme long enough for your body to have built the antibodies. Unless you have the multiple bullseye lesions that I talked about, when you have multiple across your body, then they are quite sure that you have Lyme and they don't bother with the blood testing. They just give you the antibiotics. All right, so yeah, that's diagnosis. So if you're early, you get just the bullseye lesion is enough to put you on antibiotics. Or if they aren't sure, they'll do the blood testing, but they'll repeat the blood testing a couple weeks later to ensure that they didn't miss anything if your body hadn't produced the antibodies yet. And then in later stages, they will do the blood testing because at that point your body will have produced the antibodies, unless you've had, again, the multiple bullseye lesions. Then they're pretty sure that you have it and they'll give you the antibiotics just to be sure. All right, and next we have the treatment for Lyme disease. So again, it's recommended antibiotic therapy as soon as you notice a tick bite. So if you notice a tick bite on your body, you go right to the doctor. And so, of course, this varies by physician, but they will likely prescribe antibiotics even without the onset of symptoms because you want to catch it before it worsens. And so for stage 1, early localized disease, often it'll be an antibiotic like doxycycline for 10 days, just to, halt the progression and, rid your body of that bacteria. And then if you're stage 2, which is early disseminated disease, you again can get the doxycycline or an antibiotic for 10 days. But if you also have further, more concerning symptoms like the neurological symptoms, you might be expected to take the antibiotics for even longer, because your disease has progressed a bit more. And then for stage 3, which is late Lyme disease, again, it's with the doxycycline. And with late Lyme disease, I said earlier, this was the arthritis stage. You can be given a longer treatment if your joint inflammation, the arthritis, continues. And so one thing to note with Lyme disease is that some people do develop persistent, non-specific symptoms after the recommended antibiotic therapy. And this is called post-treatment Lyme disease syndrome or chronic Lyme disease. And unfortunately, there's not a lot of research done on this. And there's definitely a gap in research, in my opinion. So I don't know much about this, but I think it's around 5 to 15% of people do develop this chronic Lyme disease. And there's not much research on, how to treat this or, what the symptoms are to look out for. And, it's a bit sad, but hopefully, with more research and more money put into research, hopefully they can, put more time and effort into determining how to treat this. And just because, a lot of people are affected by it, and often people can live with chronic Lyme disease for a very long time, and it can be quite debilitating. So unfortunately, I don't have much to say on that today, but hopefully in a couple of years, there will be more to say on this. And I'm sure there are lots of Lyme disease specialists out there who know much more than I do, but currently that is from what my understanding on chronic Lyme disease is. And so that's treatment. And next I want to move on to prevention, which in my opinion might be the most important part of this talk today, because if you practice good prevention, then you won't ever have to deal with any of the symptoms, diagnosis, and treatment. So ticks themselves, ticks infest a lot of areas in spring and early summer, which is when the nymph ticks, which are the ones that transmit Lyme the most. That's when they are born, and that's when they're feeding. And so it's really important to be very vigilant in the spring and early summer. And so these ticks prefer moist and shaded environments. So that includes like leafy, wooded areas, so like in a forest. And it can also include overgrown, grassy habitats. So picture like places with really tall grass. Because they love to hang out in the grass or in these leafy wooded areas. They love to hang out like under leaves so that when you like brush past it, they can latch on. So it's really important to try to avoid these areas. But of course, you can't always avoid these areas. Maybe you work in these areas. Maybe you want to go on a nice hike. I love to go on hikes. Or even if you're not in a place where you think would be tick infested or would be good tick habitat, but you still want to be protected. I have some good strategies that we can use to ensure that we can stay as tick safe as possible. So the first set of strategies I consider is for what you do before you go into a tick habitat. So before you go, I was just wearing light colored clothing, which helps you really spot the ticks, because again, ticks are dark. And so if you have light clothing, then it's easy to see if they land on you, and you can brush them off before they, find skin and bite. Another good way is with this clothing, you can tuck your shirt into your pants and your pants into your socks, and that way you have no skin exposed, which is really important because ticks can land in your clothes, but they'll continue to crawl until they can find like an opening in your skin, and then they can crawl to a place where they're, comfortable or looks like a good meal for them, and then they'll bite. So having your shirt tucked into your pants and your pants into your socks is really helpful, because then the ticks can't get at your skin, at least for a long time, until like you find it and you can brush it off. Another important thing would be to wear closed-toed shoes. Again, this is the same thing as, tucking your shirt in, is that the more skin covered, the less likely the tick will be able to find a place to bite. You could also use insect repellent with DEET or other specially made tick repellent. I'm not really sure what the chemicals are called, but they definitely make tick repellent spray, and it's quite effective in my experience. And there's also certain clothing that's permethrin treated, and I actually have some here today. So you can buy clothing. I have socks here that come treated with like insect repellent, so the ticks like will not like this, and they won't like latch onto your body when they smell this. And it lasts, each one is different, but it'll tell you it lasts like 50 washes or something. And so I'm sure most outdoor stores will sell something like these. You can search them up online. These are socks, but you can also get shirts, you can get pants, you can get hats, you can get gaiters, which are the things that like cover the space between your legs and your shoes. There's all sorts of things out there. And just a quick Google search will probably find you many different brands. All right, so I covered before you go into a tick habitat, but next we'll talk about some strategies for while you're in a tick habitat. And so I would say it's really important to walk on cleared paths or trails. And this is, of course, important because when they're cleared, you don't have the tall grasses, you don't have the leaves that might be hitting you that have ticks on them. And so it's always important to walk on the designated paths. They're there for a reason. Another important thing is to keep kids and pets from wandering off the paths, because again, they're perfect targets for ticks to latch onto. And I would also suggest to avoid trails created by animals like deer or moose, because ticks are often found on the grass and plants along these trails because they know that's where the animals go, and that's where they can, latch on and get a blood meal. So yeah, those are all, I think, effective strategies to help protect yourself while you're in a tick habitat. And then once you're done with your outdoor day, before you go back indoors, like into your house or anything, I always do a body check. And so and it's especially much more helpful when you're with a buddy because you can't see your back. And so you basically do a body check head to toe, looking for ticks anywhere. You check like your entire body. You have to make sure there's no ticks on your clothing, on your skin. And then you do it on your children because they can't do it themselves. And you also check your pets. And I think it's especially important to check your pets because especially pets that have like long hair, like if you think of like a big fluffy dog, ticks just get like caught up in their fur, and they bring the ticks inside, and then like they snuggle with you or they hop into your bed or your couch, and the tick can end up on the couch. And then when you sit on the couch, the tick can end up on you. So it's especially important to do your body check on your pets. All right. And then, so that's what you do before you go inside. And once you're indoors, a really effective method is to shower within 2 hours of going in this tick habitat. That way you can find any ticks on your body and wash them off, hopefully before they latch on. If they do latch on, we could talk about how to remove ticks in the next section. But yeah, the shower is a really important time where you really check for the ticks and you can wash them off. And then some strategies to reduce tick habitats around your home is to mow your lawn regularly to keep the grass short, because I said earlier, they love tall grass. It's also important to remove your leaf litter. And so if you have leaves around, leaves will decompose, and it kind of makes like a moist, shaded environment for ticks, which is where they thrive. So removing your leaf litter, if possible, is a really good strategy. And you can also talk to your veterinarian about tick prevention in pets. And so I obviously don't know much about tick prevention in pets because I'm not a veterinarian, but I know that maybe it's a medication or a shot where if the tick bites the pet, the tick will die and then will fall off. And so that's always something you can discuss with your veterinarian if that's something you'd be interested in. And yeah, I think we've gone through all of our prevention strategies. And next I will go into removing ticks and killing ticks. So the most important thing to consider when removing ticks is that you don't want to squeeze the body of the tick. I know that ticks are really small, and this would be it's difficult to kind of see what you're looking at, but you can kind of see like there's like the head and there'll be a little like round body. You don't want to squeeze the body, because if you squeeze the body when you're trying to remove the tick, that can actually squeeze and push the bacteria into you, because the tick is latched onto your skin. And that's the last thing you want, because you don't want the Lyme disease entering your body. And so instead, what you do, and it's a really simple way to remove ticks, you can use a pair of tweezers like here. And what you do is, let's say the tick was on my skin, you would grab the mouth part of the tick right on the skin, grab it, and then you would pull straight upwards, removing the mouth from your skin so that you have no risk of squeezing the body of the tick, and you're removing the mouth so that, you're fully removing where it's attached to your arm. And then from there, often I personally would save the tick, because you can save the tick and you can bring it to the doctor's office, and the doctor can actually check if the tick was infected with Lyme disease, which is always helpful to know, because it'll let you know if you need to take antibiotics or not. So yeah, there's the option of removing with tweezers. You can also, if you're uncomfortable with doing that, or if you don't think that, you'll do it properly and grab the mouth, which is fair because they're tiny and you might not feel comfortable with it. You can get this done at the doctor's office, depending on who your doctor is. One way that they remove ticks in the doctor's office is they'll inject xylocaine into the skin below where the tick has attached. And so they'll inject it underneath, and that causes a big xylocaine blister to form. And then the tick will taste this xylocaine and it'll go, ew, gross. Like, this doesn't taste like blood. This tastes like xylocaine. And it'll let go. It'll release to find a better tasting host. And so that's one way to remove your ticks if you're uncomfortable with doing it by yourself at home. And then from there, once you remove the tick, whether you're at home or at the doctor's office, you can request antibiotics as a precaution. I imagine this is typically done because, you don't want to risk getting Lyme disease, of course. And yeah, I think that is everything for today. We've gone through the history of Lyme disease, where it's found. We've gone through the spread, the symptoms, the diagnosis, the treatment, and prevention. So if anyone has any questions, you can put it in the chat. Oh, my son once got a tick bite after being out camping with friends. Yeah, that is scary. I found 2 ticks on myself when I was in Vermont one summer, and it was horrifying. It's not like a happy sight, because, you don't like the idea of having a little bug on your skin. Taking a blood meal for sure. Yeah, the tweezers are difficult. So you can use a metal tick key remover. There are specific, yeah, Natalie's correct. There are specific things you can use, like specific devices, and you can buy them specifically for tick removal. I don't have one here, unfortunately, but I imagine, again, with a quick Google search, you can definitely find them. And especially if you live in an area, or if you do a lot of outdoor things, or if you live in an area where tick and Lyme disease prevalence is high, that would be a pretty good investment to make, because you can never be too safe. But yeah, that's a really good thing to have on hand for sure. Yeah, definitely smart to always have it on hand, especially if you do a lot of outdoor things. And yeah, kids leave the walking paths. Yeah, kids and pets the most are definitely something you have to look out for, because of course they want to go have fun. But there's always, things to keep in mind when you're doing outdoors things. Unfortunately, being in the outdoors is not risk-free. So yeah, having the metal tick key remover is definitely super helpful in those situations. All right, so we're almost at the 30-minute mark. So if anyone has any questions, you can write a comment. Otherwise, I think this is the end. Okay, thank you so much, everyone. I hope you had a good time listening, and I hope you're ready to be tick safe out in the outdoors. Thank you.